Device Nation behind the booth here, Academy 2025 with Dr. Alan Rechter. Welcome to San Diego, sir.
Good to see you.
Heron Therapeutics ZYNRELEF. We've been talking about this product a lot to the Device Nation audience. You have a presentation going on today. Give us a sneak peek of what you're going to be sharing.
I do. We're going to talk a little bit about ZYNRELEF, its effectiveness, how it's applied. I've been involved with the ZYNRELEF actually since the early stages in the trials, but pretty amazing product. Really works well. Really, I'm a practicing surgeon, so this is something not that I just talk about, it's something that I use on a daily basis. It's really effective in decreasing people from taking pain pills after surgery.
So for people listening that have never heard of ZYNRELEF, what's in it?
So it's really two products that people go, all right, I've heard about it and I use it a lot. It's bupivacaine, which is a local anesthetic, kind of in the cane family, and meloxicam, which is a generic anti-inflammatory. But really what makes it special is Heron developed this proprietary polymer that when you put them together, it lasts for a 3-day period. And over those 3 days, it oozes into the surgical site. So when people are taking a bunch of pain pills because they're having inflammation after surgery, this really mutes that response. So it's really effective in doing that.
I got a chance recently to see the new vial access needle. Has that been a game changer for y'all in terms of delivery?
Absolutely. It's one of these things, people made it seem like it was a bigger deal than it was as far as the nurses and whatnot drawing it up on the back table. It's not really that hard to do anyway, but even saving a few minutes here and there certainly makes it better. And obviously in the future we'd love to have it pre-delivered, which is probably coming, but the bottom line is just getting it in the surgical site. So whether it was drawing it up like we used to do or the new vial access needle, they're all very good, but improvements on an old theme.
Let's talk 1 second about getting it into the surgical site. There's a lot of surgeons watching this right now that are used to injecting all over the place before they close. Any benefit to the delivery mechanism of ZYNRELEF versus that?
Yeah, I think so. I always like to use the expression in life, everything's good and bad. The good news is you got this amazing product. It works really well. The negative is it's a little bit greasy, so if you get it on your gloves, it's a little bit greasy and maybe frustrating from that standpoint, but you really don't even need to touch it. What we've really learned, we spent a lot of time at the very beginning putting it all over the inside of the right, inside to the left, and all over. The bottom line is to get it in there. It self-spreads itself, so we've kind of learned to make these little windows, and you put the applicator tips in the window and just push the product in there. I've opened the joints back up and looked at it to show that it's really spread around, and once it gets its coverage, it does its thing.
Good stuff, Dr. Rechter. I wish you great success in your presentation. Great time here at the Academy. For people watching, especially reps, right? If you're thinking of adding something to your bag, you need to really consider this one. I know a lot of people that have had so much success with it all around the country. ZYNRELEF.com. Check them out. And thank you again, sir. Hope you have a wonderful time.
Thank you.